Welcome back, Victor. It's nice to see you again. We've done all our paperwork and we've followed up to make sure we've got everything in order. We got your physician to give us a signed prescription so we can do oral appliance therapy on you. And he knows about the affidavit of intolerance to CPAP, so that he knows you tried CPAP and you weren't successful for it with using it. And we also got your medical insurance figured out so that we know what your copayment will be. And so we've given you an approximation and you've agreed to pay your copayment so we can move on. Now the last thing is informed consent. Informed consent covers the risks and benefits of using oral appliance therapy. And you signed it, but I want to make sure that you understand the most important parts. The first thing is, when you use an oral appliance, it's a mandibular anteriorization device. This is what we're recommending for you, and that's going to bring your jaw forwards at night. When it brings your jaw forwards, it gets your tongue out of your throat so you can breathe better. The downside is about 15% of people like to have their jaw a little further forwards, which means in the morning when you get up and you try to bite your teeth together, they may not go back together straight away. Typically it takes, to begin with, maybe half an hour or an hour for the teeth to come back together. Now you can do exercises, pushing on your jaw gently, chewing heavy gum, or even we sometimes make a second appliance for you to bite on to help bring your teeth together. But as I said, about 15% of people, their jaw likes to stay a little further forward, so you're going to be hitting more on your front teeth and less on the back. Now, if that's too much trouble and we can't reverse it with physical therapy and physical medicine, and it bothers you too much, then you have to stop using the oral appliance. Otherwise, if you continue to use it, you'll have that forwards position of your jaw and you'll notice the difference in your bite. Now, once you look at that as the main issue, the other side issues that can happen with oral appliance therapy is sometimes the jaw joint or the muscles get sore. Now, you've got quite a robust jaw joint. I don't think you're going to get into trouble, but I can't predict it 100%. If it does get into trouble, we'll help you through with some physical medicine again. And then the last thing is sometimes some teeth shift and drift. And if that's the case, even with oral appliances, you'll have to accept the consequences. So that's one of the side effects. Now, I'm very glad you got your teeth cleaned and you got those fillings done by your regular dentist. So we're going to move on now and we're going to take the impressions. Are you ready?
Yes.
Okay, let's move on. Okay, Chrissy, if you would mix for me. I'm going to rewash and we'll get to work.
Okay.
And you can load that for me, Chrissy. Okay. Great. And open for me. Open. Okay, I'm just going to hold that for a few more seconds. Now we're using an alginate with a automatic mixer that gives us a more consistent, creamier mix. And we're also using an alginate that changes color when it's set, and that's nice. It gives me a little more insight so I don't have to wait too long. And then once that's ready, we're going to go ahead and take the upper impression, and then we're going to take a bite to try to get the position that we want your jaw to start off in with the repositioning device. All right. Appears to be set, and I'm going to release it at the back. If you just relax, I'm going to go underneath your tongue, a little popping noise. Excellent. We snap it out, and we have a lovely impression. A little bit of gum bleeding, nothing major. Okay, go ahead, Chrissy. Let's mix the next one. Great, thank you. Now I want you to take nice deep breaths. Let me hear you breathe. Very good. Okay, you're not much of a gagger. Okay. So we're going to let that set. Now once we've got these two impressions, we're going to take the jaw and practice biting in a good position. Now the maximum that you could come forwards was 9 millimeters, so my hope is to bring you forwards a minimum of 5 to 6 millimeters to begin with. We shoot to get you up to 70% or 80%, depending on your response and whether or not your jaw gets sore or not. So if I can have a tissue for him, Chrissy, then he'll be able to wipe off, or a warm towel. Okay. And the color has changed on the impression, so I'm going to release it again. If you just relax, I'm going to get a popping noise at the back. Let's try this side. There we go. Well done, and we've got another nice impression, including the little poking through of your wisdom teeth. If you look, you can see just your wisdom tooth starting to poke through. Okay, very good. So we got both of those. Now those will be poured up straight away, usually within 3 minutes, and that way we'll have an accurate representation. And we'll pour them up in the lab and put them in actually an impression tree so that they don't distort. In the meantime, I'm just going to be softening up some wax, and that's how we're going to get a representation of your bite. Okay, so I'm folding this wax bite into 3, and they can see that, and then I just fold it over a little bit at the sides to mimic a horseshoe shape, and this is just the right temperature so it will get soft as we need. So now I'm just going to practice getting you into the right position, which is about 5 to 6 millimeters protrusive. So bite on your back teeth first. That's the back position. Now slide your jaw forwards a little bit. Keep going, keep going, keep going. Go as far as you can. Close your teeth together in the forwards position. That's too far, so you're going to go back a little, back a little. That's the right position. And I'm noticing the midline is on, so that's where I'm going to be putting you in that position. So just tap your teeth together in that position, and I'll confirm it with my ruler that we're exactly right. Okay, and open for me. So open a little more. So I've positioned the wax. Now slide your jaw forwards for me. Come forwards more, 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 more. That's it. Now close in that forwards position. Okay. Come forwards a little bit more. A little more. Close. Okay. Open. Bring your jaw forwards just a little more. Okay. A little bit more. Stick your jaw right out. That's it. Now squeeze. A little more. And you are just right there, but the midline is 2 millimeters to one side. So open for me. It's not quite right. You're very close. What I noticed is you could come forwards just a little bit more. So I'm just going to soften the wax so it's easy for you to just reposition a little bit. Just going to get a fresh surface on the wax. So will you practice coming forwards again? Come forwards, slide your jaw forwards. There, that's it. That's where I want you to be. Open for me. Okay, bring your jaw forwards more. That's it. Now close. A little further forward, slide more, and close. That's it. Hold there. Very still. That's exactly right. It's confirmed with the millimeters. It's confirmed with the midline, the way we wanted it. It's within a millimeter of the initial position. And you can open for me, and we're set. We just confirmed that we got a nice clear bite. We do on both sides. So that's it. You're ready for the warm towel and scheduling your next appointment. Okay? Well done today, Victor.
Thank you.
You're welcome. Good morning, Victor. How are you today?
Morning, Dr.
It's
Simmons.
nice to see you.
Nice to see you again.
So today, you know what we're going to do. We're going to fit your mouthpiece, and we're going to also give you a morning positioner mouthpiece, and we're going to see, does this help with your snoring and sleep disordered breathing? Okay, you ready?
Yes.
Any changes since last time in your health?
No.
Any dental work?
No.
Any medication changes?
Nope.
Okay, let me wash up and we'll give it a go. Will you be able to get any feedback from any bed partner or somebody that's nearby to hear whether or not you're snoring or not?
Yes.
Okay, that's going to be very helpful because I'm going to ask you to keep a diary, and you'll ask your confidant or whoever it is that's nearby to share that information with us. Okay, so let's start by fitting everything, and I'm going to have my nurse Chrissy bring in a bowl of warm water. If you do that, please, Chrissy. So let me take a look in your mouth first of all, and I'm just going to confirm a few things. First of all, I want to make sure that there's no changes in your bite, and I want to also document this bite positioning. So we're going to go through each tooth. Close down, hold, close down, hold, close down, hold, close down. And what I'm doing is going tooth by tooth, close firm, open, close, open. And again, we're closing on our back teeth. Good, close, open, close again. Great, close, close again. Chrissy, would you mark these down, please? Open, close. He has firm contact on 18 through 22 and number 27 through 31. Now, he does have wisdom teeth, and I think those will be history.
Yes.
Eventually. You've got that planned. Okay, so we got those contacts marked down. Let me just take a look at your overjet and overbite. Bite down. These things are important because when we have you wear one of these mouthpieces, there's a group of people, about 15%, could be more over a longer period of time, that have their bite shift where their jaw wants to stay further forwards. We have 3 millimeters of overjet. We have 1.5 millimeters of overbite. The midline is 1 millimeter to the left. I just want to quickly check no soreness or noises in the joint. Open for me. Close, open, close, wiggle sideways. Good, protrude. Yeah, good. Now lean your head back and open again. I'm just loading the joint. Okay, so no tenderness in the lateral or dorsal joint. Open for me. Just going to press on a few muscles. Are you getting any headaches, earaches, or anything?
No.
Anything tender? Not really.
No.
Okay, perfect. So we're ready to move on with the fitting of the oral appliance. Okay, Victor, so now we're going to fit the mouthpiece, or actually there's going to be a couple that we're going to fit for you, and I'm going to show you how to use them. And Chrissy will go over the maintenance and make sure you know how to look after them. And after today, we're going to want to see you in about 3 weeks. And the other thing we're going to do is we're going to take a baseline with a home test, just so we got some other information aside from the sleep study that you had, okay? And I just want to point out that this is what happens. The reason we took multiple impressions on you is this is what we tend to get back from the lab. They've done work on the models and they can be chipped and broken, and the wax bite that positions you is a little wrong. So we have a backup just in case something happens. You know, maybe the delivery man takes off and doesn't return. So anyway, we've got that ready. So let's go through now the different items that we're going to be dealing with today. We've got several different items, and I want to make sure you understand them. First of all, this is the mouthpiece, the oral appliance, which is going to be something that you're going to wear every time you go to sleep for more than just, let's say, a quick nap. Typically, you'd want to wear it because we're worried that when you go to sleep, your airway's closing. And so this will keep your airway open. And it's actually 2 pieces, even though it looks like it's 1 piece, they separate, and you can see the little plunger and stuff separate. So I'm going to make sure that's rinsed off, and we'll put a little mouthwash in there as well to make sure that it's a little bit more tasty than the acrylic monomer. Okay, so I'm going to put that back here. Now, the other items that we've got is we've got a morning positioner. Now, do you remember what I said about in the morning you will sometimes feel that your teeth don't want to come together, and when they don't want to come together, it's hard for you to bite your teeth at the back. You'll be able to bite the front teeth together, but not the back ones. So in this case, this is a morning positioner, and this is an additional mouthpiece that I make patients because I want to make sure that they're able to bring their bite back together. So I'm going to rinse that off, and we're going to fit that first of all. Now, the other items that we've got here are rubber bands, and the reason you have rubber bands is that sometimes these rubber bands break, and there's different positions that we can put these rubber bands in, but this is the standard position that we're going to start. And this mouthpiece, incidentally, is called a modified Herbst, H-E-R-B-S-T. And so these rubber bands you change perhaps every few weeks. Okay, I used to have patients change them every day. There's no advantage in changing them every day. Okay, so let's start off first of all with the simple mouthpiece, and then we'll progress to the other one and fit it. So let me just get my mask on,
and change gloves, and we'll get started. So once we get you not snoring, you're going to be much more busy, huh?
Yes.
Let's sit your head back. You scare people off when you snore. Okay. So this is the mouthpiece that you would wear in the morning, called a morning positioner. You can see me fit it. I'm actually just making sure there's no rocking or anything. Now, if you'd bite your teeth together, that's great. It's a nice, pretty blue color. I hope that's one of your favorite colors. Open for me. And then let's go from there and see what we can do with you taking it in and out. So basically, you would just lift it from the side here and here, and then put it back there. So why don't you try taking it out for me, and then you can put it back in. Very good. Take it all the way out, and now put it right back in for me. And that's very simple. Bite your teeth together. Very simple, right? Great. Okay. Very good.
And roll.
Okay, Victor. So we managed to do the morning positioner. That's your first challenge, and you sustained a good outcome there. So now let's move on to the other one. Now I want to just show you that I'm separating, and you can see the two components, and the rubber band is really just there to hold those two components together, although it does stop some vertical opening. The other thing that's interesting about the rubber bands is that they can be positioned in a different position. If I make them more front back, they resist you protruding your mandible so much. If I make them more vertical, they resist more of your opening of your mouth. They won't actually stop you because they're only about 2-ounce rubber bands. Okay, so let's sit your head back, and now I'm going to fit the top member of the two pieces. And what I'm doing is trying to keep your cheeks from getting pinched, and I'm fitting side to side, and I'm fitting front to back, and I'm making sure, is there any rocking? Do you feel any rocking?
No.
Okay, I feel none also. So my next question to you is it tight anywhere? Is it digging you, impinging on any tissues?
It's a little tight here.
Okay, so it's pushing on your front teeth. Can you tell me which direction it's pushing your front teeth? Is it pushing them in or out?
Out.
Pushing them, okay. So I'm going to adjust that a little bit. I have an acrylic burr to adjust it. And that's right over here. And I'll pick the right one. Okay. This is what I would like is, before Victor goes today, give him that paperwork that I thought would be interesting for him to read. We're going to give you some information that was printed by the National Sleep Foundation that talks about different things associated with disturbed sleep. We want to keep you motivated wearing this mouthpiece, and certainly our concern is that you use it just for a short while and then you give up on it. So we're going to keep reinforcing why it can help you and make sure that you're going to want to wear it. Did I hurt you?
No.
Okay, is that less pressure now?
Yeah.
Yeah, okay, is that comfortable for you?
Yeah.
Okay, so I'm just going to check retention. I feel like I can do a little bit more retention, so I'm going to actually adjust the little ball clasps that are in there. Would you get me a bird beak plier, please? Okay, so I'm going to see if I can make them a little bit tighter. I'm going to use a spatula just to guide the ball clasps off of the acrylic. These are little ball clasps, and they just anchor in the embrasure or the space between your teeth. And by just activating them a little, we can get more retention. Now, why do we want retention? Because we don't want this disconnecting from your teeth. Sit back again for me. During the night. Okay, that feels better already. Okay, very good. I'm going to make it just a little bit tighter. We'll see who gets this done first, either me or my nurse picking up the bird beaks. Okay. I'm going to try one more time. Okay, that has a much nicer feel. Does that feel too tight to you?
No.
Okay, good. Okay. Now we can make it tighter in other ways if necessary. Sometimes I'll add a little drop or two of acrylic, and that will also make it tighter. Now that's the front member. Now that's the upper member of the oral appliance. Now we're going to fit the lower. And when I'm putting it in, I'm holding the little bars so they don't dig you so much. Why don't you sit your head back all the way on the pillow? Very good. And again, I'm fitting it. Oh, great, thank you. And I'm not feeling any rock. Feel pretty good retention here. That one is not so much. Thanks, Chrissy. Okay, so I'm going to use this plier, and I'm going to tighten the top one. Will you try taking that one in and out? Lift it, yeah, lift it at the side. Very good. You comfortable? No problems? Is it tight on any teeth? Pushing too much anywhere? Seems okay, or problems?
It seems alright.
Okay. Okay, let's fit the upper now. Okay, that's much more solid. Okay, very good. And let me take that out. Okay. And we will add a tiny bit of acrylic on the front just to make it a little bit more attentive, because I'd like to make sure everybody knows that it's readily possible to do. Let me show you how you put this back together, Victor. Okay, so basically what you want to do when you're trying to fit anything back together is go, okay, how should it fit? And you've got the upper and the lower, you want it that way. Obviously, if it was like this, it wouldn't work, okay? So then you go, okay, I want to try to fit the plunger and the cylinder together. So if you take one side and you fit the plunger and the cylinder, what I recommend is then you take one of the rubber bands and you connect it. And how do you connect it? Just vertical. Okay, now once that's connected, it's not going to separate so easily, and then you can do the other side. Okay, it looks very simple, but again, I've done it before. It can be a little bit tricky the first time. You may feel a little clumsy. Now, these attachments do have little Allen wrench screws in there, and the lab does supply an Allen wrench. We don't give it to you. You know why? We don't use it. They supply it to us because it came with a kit, but basically, it's not for use. Okay? Okay, so I'm going to have you sit your head back, and now we're going to fit the piece when it's joined together. You can feel it snap in, and I always recommend you put in the bottom after the top. So if you're going to put the top in first, it comes out last. So the way I'm going to show you to do that is you put it in on the top, and then bring your jaw forwards, bite in there, close your teeth together. Okay, and now we want to see if you can bite all the way. Okay, very good. Does that feel comfortable to you? Yeah. Your jaw feels forwards, right? Okay, now I'm going to see how much further forward you can go by using a little millimeter measure. So close your teeth together, regular. Slide back as far as you can. Fantastic. Now what I want you to do is slide as far forwards as you can. And what I'm doing is I'm measuring how many more millimeters can you move. And you can move 5 millimeters further forwards on that side, and you can move 5 millimeters forwards on that side, which is good. So that means we are at least 50% of your maximum range. Now I want you to take it out. This is how you take it out. You put your thumbs underneath these screws, and then you open your mouth against your thumbs. Open your mouth. Perfect. Now I want you to wiggle from the top. Perfect. You did great. Now I want you to put it back in. Goes in at the top. And now bite your jaw forwards. Fantastic. That looks good. We're going to sit you back and make sure you're comfortable. Just before I do that, yeah, that, you know how you opened and it just came a little loose at the top? We're going to make it a little tighter. Now I want to do one other thing. Open for me. I want to just measure what your maximum protrusion is. So bite on your back teeth. Bite regular. Okay, and the millimeters here.
I need to stop you right there. Look.
3. Okay, slide forwards as far as you can. More. More. Yeah, you go 12 millimeters. Okay, very good. Okay.
Welcome back. Thank you for filling out the update form. I noticed it shows that you're sleeping a lot better, and you're doing okay with the mouthpiece.
Yes.
So give me a little feedback. Are you wearing it every night?
Yes.
And how many hours? The whole night?
The whole night.
Fantastic. And any sore spots? Any problems digging you?
No major problems.
Okay. So what about in the morning? Are you able to bring your teeth back together, or what happens?
I have to use the repositioner, and it takes me about an hour to feel
better
again.
Okay. And that works for you?
Yes.
So in the morning, you probably don't want to have grape nut cereal or something that's heavy, dense to chew. You probably want more mushy stuff so you don't strain your jaw. And so I noticed you got the mouthpiece. Okay, very good. And there's the mouthpiece you've been wearing. Excellent. Okay, so I'm going to take a look at you and see if you can tolerate being moved even further forwards. So the reports so far are that it's a lot better. How's your daytime sleepiness? It's still a little bit? Still a little?
Little. It's
okay.
Better.
Okay, you taking naps every morning?
Yeah,
still? Shorter?
Way shorter.
Okay, so let's take a look. We're going to measure you first of all and see if your jaw is the same. So let's start off with just
checking your jaw out. Sit your head back for me. And open and close and open and close. Any soreness?
No.
Any soreness?
No.
Okay. And I'm not feeling any noises. Open for me and close. His blood pressure and pulse and everything's the same? Everything's good?
Mm-hmm.
Okay, good. And any change in weight?
No.
Okay, so we want to see if we can get you maybe a little lighter on your feet, huh?
Okay.
So, all right, open a little more. Is it sore here? Nothing?
No.
You getting any headaches or anything?
No.
Okay, open a little bit. Sore? No? Okay, so I'm just testing the muscles. Make sure that you have no problem. Okay, and I'm going to look in your mouth, make sure there's no digging or anything. You look great that way. All right, let's measure your mouth opening. Open big as you can. It's 50 and stretch. Any stretches to 54. Bite your teeth together. Bite normal. Slide your jaw as far forwards as you can. And close on your back teeth. It's coming forwards 12 millimeters. Midline is 1 millimeter to the left. Slide your jaw sideways. A little more. Okay, so 9 millimeters to the left, come to the right. It's 8 millimeters to the right. You can let your jaw loose as you can. Oh, it's getting a little looser. That's good. Yeah, muscles are relaxing a little bit. Perhaps you're not clamping and gritting so much, huh? Okay, so that's all good that way. Let's confirm the bite contact pattern. Okay, open for me, bite together. Open, bite, open, bite, open, bite, open, bite, open, bite. It's got firm contacts 18 to 22. Open, close, open, close, open, close, open, close, open, open, close, and 28 to 31. Firm contacts. The wisdom teeth, I guess, are still waiting to come out, huh?
Yes.
Okay. Let's just check here. I'm going to give you the overbite and overjet just to make sure there's no changes that way as well. Bite together. Okay, so he's got 3 millimeters of overjet and about 1.5 of overbite. And why don't you pop this in for me? Thanks for keeping it nice and clean. That's good. And now let's see how much you can protrude. Slide your jaw forwards. So close your teeth together, slide forwards. More, go for it. So it comes forwards 5. Still 5, I think that was what it was last time as well. Let me just check the bite on this. Close, open, close, open, open a little more, close, open, close, open, open a little more, open, close, open. Okay, that's really good. Okay, so I'm going to advance it another millimeter and we'll see how we go like that. The way I advance it, Victor, is I'm going to add a little spacer. They're like little rings. Some of these appliances have self-adjusting screws. I prefer to add the rings so that I know I'm the only one adjusting it. It doesn't have to be that way. It's just there's an advantage. Oops, we lost the rubber bands. Okay, we got plenty more. Chrissy, can you pass me some more rubber bands? Okay, so you don't touch the spacers, they just stay on. Great, thanks very much. I'll give you a nice, clean looking rubber band. You deserve it. Okay. And basically, I just put the ring onto the plunger, if you can see there, all right? And we have different size ones. This is a 1 millimeter ring, and we have other ones that we can use depending on how far we want to advance you. Now we know we only had a maximum of 5 millimeters at this point, and we typically don't go the whole 5 because we like you to have some leeway. Chrissy, may I have one more rubber band? I sent that one flying. It was a flying rubber band. It was alive. Great, perfect. Okay. All right, we're going to have you try this in again and make sure that it's comfortable and you can tolerate it. Okay, put that in. Now when we feel like we're at the maximum, we will repeat the sleep testing, and then we'll see how improved you are. And then sometimes we'll have a sleep study in the lab again. Now in your case, you didn't have terrible number of events. You weren't classified as sleep apnea. But sometimes we will repeat the study down the road, especially if we feel like it wasn't an accurate study. Like you said, you didn't really sleep well. So just let your lips come together and nice and relaxed. You okay that way? Mm-hmm. Okay, we're going to let him stay there for about 5 or 10 minutes, make sure he's comfortable, then that he can take it in and out, and if he's all set, he's ready to go, and we'll see him again in 3 weeks. Victor, it was great to see you again. Keep the diary again for me. We want to make sure that we keep track of how good your sleep is and any other complications. All right? It's great to see you. Bye-bye. Okay, Victor, I want to show you some different mouthpieces, and really you might look at these and go, wow, that's a lot of them, but it's really not all of them. There's over 100 different designs out, and a lot of these have got names that relate to who the person is that designed it. Okay. And I don't have any vested interest in any one of these. I haven't designed one. I'm not selling one. But I'm going to give you a little overview because we have to decide which is the right one for you and what would be the pros and cons to the different ones and why I'm picking one for you as the best choice. Okay. So first of all, there's 2 different designs of mouthpieces. There are some that are used to bring your jaw forwards and your tongue out of your throat. They're called mandibular anteriorization devices. It stands for MAD. You're not mad by wearing them, but there's other names that they have, like mandibular repositioning devices, anterior repositioning devices. There's a lot of different names, but basically they're doing the same thing. They're trying to describe what happens, which is to bring your jaw forwards like a boxer, and your tongue, which is connected to the underneath of your chin, the inside, by a muscle called the genioglossus, and that brings your tongue forwards and out of your throat. Now when we look at the 2 different types, we go, okay, one type is a repositioning of your jaw and tongue, and the other is sort of just a tongue grabber or a tongue guidance device. So here's an example of a tongue guidance device, and you can see there's a bulb where the tongue goes in, and you can squeeze the bulb and then stick your tongue in from the back into that sort of vacuum, and then your tongue supposedly holds there. If you've got a slippery little tongue, they don't work so good. Bigger tongues tend to work okay. And yes, in the morning your tongue can be elongated. A newer design, I haven't seen any validated studies, is one like this where there's like a little tongue guidance and like a little prod to push the tongue, and there can be added acrylic here to sort of go down towards the back of the tongue to guide it forwards, and that's another way to guide the tongue, and perhaps that one will have some validated studies in the future that will make it something that we can recommend freely. Then we have the repositioning devices, and these ones can be anything from sort of a flimsy temporary type one to perhaps a little stronger but temporary one. And you can see these allow for some movement, which I think is an important thing, but they're not adjustable. Like this one is not adjustable. It moves, but it just doesn't adjust. That's not an adjusting arm. These ones, again, are not very durable and designed more for snoring and less for sleep apnea. But the bars can be changed to be shorter, and as the bar is shorter, you can see it would bring the mandible forwards and get the tongue further out of the throat. And you can see different, some of the materials are a little harder, some are more flexible, depending on your particular anatomy and your particular concerns. Now, these repositioning forwards devices can also be ones that are not allowing for movement of the jaw. So here's an example of one where it doesn't allow for any movement. It's got a top and bottom member. It's even got like a little positioner to push the jaw forward some. And yes, they can separate and they can be repositioned in a further forwards position. And some of them don't even have that flexibility. But the downside to these is they stay in that position. You're stuck in that position. So if you grind your teeth and move them around at night, you can end up getting sore teeth trying when there's no flexibility or movement allowed in the mouthpiece. Now, when we start looking at other devices that bring your jaw forwards that are more durable, there's a few different designs. I like to show a design like this, which is like 2 components. It's got like little fins, and it's got a piece at the top, which allows for guidance of the jaw forwards. You can see the adjusting screw allows to push the jaw forwards. And you can adjust the screw on each side, or the doctor can, and that will allow the jaw to come forward different amounts. You can bring it forwards more on one side than the other side, just in case you have an irregular protrusive movement. This is an appliance which does the same thing, and it basically has the fins, and it has little adjustments on each side that allow to bring the jaw forwards. The thing that we've also got here is a little anterior bite tab, and what that's for is for people that grind, they have a lot of freedom to slide around. And you can see there's upper and lower little ball clasps, and these allow for me to put a rubber band on if I chose, so that you didn't have to separate the mouthpiece and put it in two pieces, and it would perhaps resist some mouth opening at night. Okay. These ones are fairly durable when they're made out of solid acrylic, but for some people the acrylic is very hard on them, and they feel like it puts too much pressure on their teeth. So they can have a soft lining on the inside. This one is another type of repositioning mouthpiece, and this one fits in your mouth the same way, and it's actually two pieces, but it's joined by the rubber band right now, and this is made with a lot of metal and it's very durable, but it has a softer inside. So you would put that into warm water, and then you would put it in your mouth, and it would sort of squish and attach to your teeth as it cools down. And these ones are very nice, but when you have the softer inner lining, it makes them a little weaker. And why is it weaker? Is because it's not got the thickness of hard acrylic, and it's laminated with a hard material on the top, but sometimes you'll see cracks in these ones just because they just haven't got the same thickness or durability. Now you can have exactly the same device made with the acrylic all the way through, no soft spongy inside, and I like that for people mostly if I can, because I'm more interested in durability. I figure you're going to be wearing one of these things for the rest of your life. Okay. Now, in the same light, we have some patients that have a lot of dental work and they're worried about gripping their teeth so hard, and or maybe they have some concerns that this is too rigid in the metal, and we have softer side bars. These are more flexible, and they come in different densities, and these pop off and pop on with different lengths to bring your jaw forwards. And this is another design mandibular anteriorization device. And you see, when you look at different ones, you go, well, there's slight disadvantages and advantages to each. For instance, on this one, it may be a little thinner, okay, and it may be a little bit more flexible here. But when you get to something like that, you may go, well, this is very smooth on the outside. It feels easier for me. I have very sensitive inner lining in my cheeks, whereas this can rub a little bit easier. So even though it's got more metal and it's stronger, the downside is it may rub and you won't wear it, so it doesn't matter, that's more durable. Anyway, with all these different devices, we have sort of that focus on moving your jaw forwards as opposed to guiding your tongue. And then we have a combination type mouthpiece which allows to bring your jaw forwards, and what happens is you put this over your lower teeth, and then you have a clear retainer that fits on your upper teeth. It looks sort of like this. Clear retainer fits on your upper teeth because this little guiding jig fits over that plastic, and by having that plastic it protects your gum. But the thing that's neat about this is that you also have these little balls on the side which can spread underneath your nose to open your nasal passages if you're closed up that way. So that has another advantage, and there's little screws at the side for us to adjust to bring the lower member forwards. Okay, so it's an adjustable by the dentist also. So those are basically some of the major designs. We have a design here that's been around for a long time. It's one of the appliances that actually allows for the patient to adjust it, and this little screw allows to adjust it. And when we adjust that screw, it brings forwards this little hook, and as it brings this hook forwards, which is connected to this bar, bringing the hook forwards brings the bar forwards, and that also brings that lower jaw forwards and the tongue out of the throat. Now the downside to something like this is maybe, again, there's some impingement, there's some area where your tongue wants to go that's impinged by the bar, and there are more modern designs of this where there isn't that kind of a bar. But the adjusting piece here sticks through your lips, almost like a duckbill, and sometimes stops you from having lip closure, so you don't breathe through your mouth so well, or you dry out your teeth and gums. But once you get to the right position, this member, this piece gets removed, and then a more permanent metal plate gets put at the front. So that's another one, and you'll notice that there's like little balls or contact balls at the back, and the reason is we want to try to make sure that your jaw is supported when you're moving around. Now, I want to show you one other appliance, and that's in the morning. When you wear some of these mouthpieces, you may find your teeth don't come together exactly right first thing in the morning. So we make sometimes, or most times actually, a repositioner, which allows you to bite down hard and bring your jaw back into position. And by biting your teeth together, the muscles pull your jaw back and seat your jaw joint, your condyles, into the fossa. It's like a ball in a socket, and by biting, you get this squishing here. So where your jaw may be a little forwards, as you bite, it brings it back into position. So these give you like a quick overview. There are temporary ones that we use for people sometimes. We don't recommend these things. We're worried that they're going to not be durable enough. And again, we're looking at you wearing this indefinitely, and we want to make sure that we got you covered from now until whenever. Very good. It was nice to see you again, and we'll see you then. 2 weeks. Bye-bye. Okay, Victor, so I wanted to talk to you a little bit about something called sleep hygiene. And the reason it's important is we want to enable you to get the best sleep possible. So a few things you should know about, first of all, are that the things that make disturb your sleep breathing most are things like having a heavy meal before bed, drinking alcohol before bed, doing heavy exercise. Anything that would make you more relaxed than normal tends to allow the muscles in the airway, in the pharyngeal airway, to collapse and close. So I tell people, don't do those things for 2 to 3 hours before bed. And I'm not saying don't exercise, I'm just saying don't do heavy exercise before bed. Don't do a heavy meal before bed. Sure, you could have a little snack, but we don't want anything that's going to make you have this postprandial depression. Is that feeling where you have a big lunch and then you go back to work and it's like, oh, I'm ready to nod off. So we want to avoid that, because that overly relaxed feeling will allow for more collapse of your airway and more sleep disturbed breathing events, more apneas, that's not breathing, and hypopneas, that's this narrowed airway breathing, this strained kind of breathing. So when you look at how could you sleep the best, you might also find that sleeping on your side is better than sleeping on your back. When you sleep on your back, your jaw tends to collapse back. Your tongue falls into your throat easier. So people that have to sleep on their back, they may want to be on a raised bed, so the head of the bed is raised. And the other thing you might do, if you don't want to sustain any sort of back strain, put a pillow under your knees. But if possible, don't sleep on your back at all, sleep on your side. There are pillows that help you to stay off your back, and I think you're going to find you sleep with better breathing when you're not on your back. So we've talked about a couple of things so far. That's how to ensure you don't go to bed overly tired. The obvious thing with that is don't pull all-nighters. Don't push your schedule. Try to get your regular 6 to 8 hours, whatever's perfect for you, every night. And if you can stay on the same rhythm, like I go to bed at 11 o'clock every night or 12 o'clock every night, that's good. That sort of rhythm helps your body get used to going to sleep. If you find that you don't fall asleep readily, you can always go through a process of having a hot bath, relaxing, reading things, and then going to bed. But I tell people, don't watch TV in bed, don't read in bed. Really, bed is reserved for sleep and sex. And if you are bringing other things into the bedroom, I think what happens is your brain doesn't associate the bed with sleep. For instance, if you're eating in the bedroom, if you're having let's say heated conversations before sleep, or watching television, or reading in the bed, I think that your brain is just not going to associate the bed with sleep as well. So those are the basic things. Now, more advanced issues to be considerate of are that if you have a cold, if you get congested, treat it very quickly and very aggressively. And the reason is, if you can't breathe through your nose and you're all congested and stuff, again, you're going to have worse apneic events and stuff like that. Basically, if you follow those rules, you're going to find that your sleep is better, it's more reliable, you hopefully will have less disturbance, and of course you want to have your bedroom a little bit cooler, and you want to have it quiet, and you want to have it dark. Those are sort of the standard things. And I tell people that if you have allergies or allergens in the bedroom, try to remove them. In other words, a hardwood floor is better than carpet. Blinds, wooden blinds, or plastic blinds are going to be better than curtains. And staying away from down pillows, down comforters where there's a lot of dust mites and stuff is also better. So synthetics tend to be better. You tend to have less dust mites. So those are the additional things that can help you so that you sleep better. And so when we have you keep your diary, we'll track
how good it is, and perhaps you'll tell us these are the things that make my sleep a little worse. And certainly if you have other things that have impact, we try to minimize the effects. So let's say you had a little baby or you had a pet, you would try to minimize or stagger with a partner how you would look after those issues so that you can get good sleep. If you get good sleep and you're still tired in the morning, then we've got to look and see what else is going on. Are you still having apneic events? Do we still need to address other things? If the oral appliance doesn't take care of the problem by itself, we sometimes will recruit combination therapy where you're wearing a mouthpiece and nasal CPAP. So there's all sorts of things we can take you through depending on your need. And we're going to keep testing you and listening to how your outcomes are, and then based upon those bits of information, the feedback we get, will determine how to take the next step. And of course, we're going to be coordinating all treatment with your physician too. All right? It was great to see you again. We'll give you a sheet that reviews everything that I just went over so that you've got something to refer to in the future.
Okay.
Thanks.
Great.